thousands and thousands of years. Those of us in the healthcare world, specifically in some of the more natural-based stuff that we do, we've used this hops extract for many, many years. But what was interesting is when we actually look at the difference in the supplementation that's out there versus what's in our fixed product. And for me, when we got into the research, we started looking at there's two major classes of different substrates or elements that come out of the hops flower. And we're going to talk about the bitter resins or the bitter acids and what they kind of do versus the polyphenols or what I call the phenolitic side, which is what a lot of the other supplementations have. And as we dive into what these acids, these isoacids are that come from the hops flower, it's interesting because they are very unique in how they upregulate certain things in our body. So when we saw the research on this and we started looking at some of the potentiation that could possibly happen if this stuff did what we thought it was going to do, according to the research, we got real excited about it. Having been in practice, as Byron has said, for over 40 years, I've never had a tool like what we now have with this product. And so I want to kind of just break down a couple little things about why it does what it does and the uniqueness, and why, because of that pathway that it gets into, we're going to see a multitude of different types of reactions that are very positive that we're seeing in the body. Now, we've been dealing with this product for over 90 days now, and have watched hundreds and hundreds of people and thousands around the world that are taking this product and seeing some of the results that happen. So I want to just kind of unpack that a little bit so we have some understanding why this is so unique that nobody else has, and why we're going to see results that nobody else is probably getting with any other type of a hops extract. First of all, this is a liquid bitter acid, right? And we will call this one of the three bitter resins that are there that have the alpha, the beta, and the gamma acids that are in there. And what's unique about that is when you put this in a liquid and you put it into your mouth, there are bitter receptors or sensors inside the human mouth that are actually there designed as a protective mechanism. So what does that mean? In the world, if we go out there and just eat things, in the natural aspect of that, there's maybe some things that are not good for the human body, and they will have a bitter aspect to them. So we have these bitter receptors or sensors within our mouth. And the moment that we put something in our mouth, we know whether or not it's good for us or bad for us. And generally in the old days, we would just spit it out. But with what they've done with food today, how they hide a lot of these things, the body tends to let it go ahead and be swallowed. So when we take this fix and we put it in a drink and we put it in our mouth, immediately the bitter sensors open up and hit a receptor, and that sends a signal to our brain, and it hits what we call the vagus nerve, and it goes down to the stomach, and it stops things from going through so they can process what it is. Now, the moment you swallow that, from the mouth to the tongue, all the way down the esophagus, and even in the trachea, by the way, in the lung pathway, it opens up all these receptors and is trying to identify what we just swallowed. Now, the irony in that is that when it gets down into the stomach, it then hits another system that's called the brown adipose tissue, and that turns on a thermogenic reaction, which then goes and makes the white fat be broken down so that the body's immune system and its metabability, or its ability to break things down, has enough energy to go in there and break it all down looking for the poison. And here's where another funny thing happens. Since there is no poison, the body has massively produced metabolism to break all the foods in the stomach down, and it's burned white fat to make that process work. So when we saw this in the research and we understood that the brown adipose tissue was going to be upregulated and convert the white adipose tissue to break down for energy to go after this, we thought we would see some pretty unique things. And there's a lot of pathways that are based upon the metabolism and the utilization of fatty acids. I mean, from the brain all the way down to hormones, to the immune system, to your skin, your nails, your hair. The list is almost endless. And when we looked at the research on this, what we saw is that when you actually break down that white adipose tissue, and there's quite a few areas that it's in, I want to just touch on them briefly here. But the white adipose tissue is under what we call the love handles. I mean, there's another name for it. It's called the subcutaneous adipose tissue. Then we have the muscle adipose tissue. Then we have the visceral adipose tissue. Then we have adipose tissue that's in the brain, in the lungs, in breast tissue, and even in bones. And so when we looked at what happens to those fatty acids, we went back and in a functional medicine point of view, we said, okay, if we have bad fats in our body, we're going to get a term that's called fat rancidity. And that fat rancidity is going to cause a term called oxidation, which means inflammation. So, one of the greatest things that we know the hops flower extracts do on both sides is that it reduces inflammation. So, when we saw that this unique acid inside the pHix was going to go in and turn all these systems on and then break down all those free fatty acids that are rancid, we would then reduce inflammation. It's kind of like having a fire and you put the fire out or stopping the damage that's potentially occurring. So when we saw that this was going to hit those pathways and turn off all those issues, that means the body was now going to have enough energy to go repair the very systems that were inflamed. So when I looked at this phase of this, and I and Dr. Phil and a few of the doctors, we started discussing what these things were doing, we got real excited about that. So at this point, I'm going to turn it over to Dr. Phil, let him add what he wants to add in on that part as well.
Awesome. Thank you so much, Dr. Bowers. And I'm glad to be here today to share with everyone about what we're talking about here with this very unique product, matured hops extract. When I heard about it, I got word that this was coming. I said, well, I know all about hops. I've been, I've dispensed products over the years that contain hops and hops extracts. But this was something totally different, totally new. And I said, I got to do some research on this. I started researching extensively, looking up every study, every article I could find on it. And when I started reading these, I got super excited because of what I was seeing. And like Dr. Bowers, I was thinking, if this does what these studies say it's going to do, this is going to be huge. This is going to make some, life-changing differences in people's lives. And one of the things that I had been researching prior to learning about the hops extract that we're talking about here was fatty liver disease, because I have numerous patients, clients that have been diagnosed with fatty liver disease. And so I'm thinking, when I'm seeing this, we're talking about burning up the visceral fat. We're talking about breaking down all body fat over time. We're talking about reducing inflammation, all the different effects I was seeing in this study. We're talking about improving digestive health with the different mechanisms of actions that can take place in the digestive system because of what the hops extract is doing in activating a particular hormone in our small intestine called CCK. Cholecystokinin is the acronym for that long crazy word there, cholecystokinin. I had to practice saying that for a while before I could actually get it to come out right. But anyway, the effects that particular peptide hormone in our intestine has on our overall digestive system, I said this is going to make a difference. This is going to be a game-changing product. But back to the fatty liver issue, that was something because right now there's currently no medication for fatty liver disease. And as a pharmacist, I'm seeing all these different medications come out all the time for all these different conditions. And but there, even though it actually is called non-alcoholic fatty liver disease that people are being diagnosed with, they're not alcoholics. They drink maybe every once in a while. Some of them don't drink at all, but yet they have the liver of an alcoholic, and or their liver's beginning to look like that of an alcoholic with non-alcoholic fatty liver disease. So when I was thinking, there's no medication, there's no drug, but these people need some help. I was doing everything I could for them nutritionally and helping them change their diet, make the correct dietary changes, trying to help reduce fat. And I said, well, this is the tool. This is going to be something that's going to help these people. And so that's what I got super excited about. And I've got my clients using it now, and we're actually seeing results with their body composition changes, with their fat percentages coming down. And yeah, I'm really looking forward to sometime in the near future when they go back for that 3 month or 6 month checkup after they've been using this product for several months, to see what their numbers look like in their blood test, to see that they have improved, that things are getting better. And so that was one of the things that excited me most. And then as I continued to do research, finding out all the other potential effects, positive effects that this extract could have on the body, like Dr. Bowers mentioned with the inflammation. This product, this extract is a powerful anti-inflammatory, and we're seeing the results of that too, with a lot of people. But it has numerous, potential helpful benefits, not just anti-inflammation, but also as a powerful antioxidant, antimicrobial, all of these things that are properties of this extract that could potentially help people with numerous conditions that they may be suffering with. And so that's my take on it, and one of the reasons why I got so excited about it when I first found out about it.
There's a lot of people that want to know, why is this different than anything else that's out there? I know you touched on it, Dr. Ben, but maybe, this is something that's unique, that we're the only ones that have this. But what makes this unique is really maybe the question. And then maybe we can wrap up this first section here and we'll go to section number 2.
Sure. For me, Brian and Byron and Phil, when I looked at this and I'm going, how many systems are involved in, let's just say, obesity, just for the example. And we look at, there's 1,100 different systems in the body. And when I start looking at all the different ones, there's a good majority of them that are based upon fatty acids. And that's why they're so critical. And when we
Yeah.
look at now, 70, almost 80% of Americans themselves are in one of 3 stages of obesity. And so we call that pre-obesity, then obesity, and then severe or morbid obesity. And then you look at like 1 out of 4 in the world are dealing with this issue. There's something wrong within what's happening within those systems that break down either fats or proteins or sugars. So when I looked at this from the research, and we saw that it was going to help break down those fatty acids, it triggered a lot of things in me to start looking at, because when I look at the ability of the body to utilize fat or not utilize fat, and that's the key. If you break it down and are able to absorb it and assimilate it, it's possible to use. If you can't break it down and you can't absorb it, then you can't utilize it. And that's why it gets stored in our fat cells called adipocytes. But when we start looking at the brain itself, the nervous system, the immune system, all the different hormones that are in the body, and then you look at all those things that we mentioned earlier where fat is stored, fat is a protective mechanism. So its first job is to actually help make all the different hormones in the body. Then, second of all, it's a protective layer. Every single cell has a fatty layer on the outside and the inside. This is called the lipid layer. And so when I saw that fat rancidity or free fatty acids that get inflamed, we know of over 200 different disease entities that it causes. So I said, okay, wait a minute. The first thing you're going to do when you put this in your mouth, it goes up to the brain and it makes a decisiveness of something that has to happen. It initiates an activity. And then it goes down to the stomach and it does that. Then it goes into the small intestine. Then it goes into the liver and picks up the cholecystokinin that Dr. Phil was talking about. Then it comes back up to the brain, hits back into the vagal nerve, goes back down again, and it triggers the immune system. I go, how many systems are involved here that this one single element or this combination of these 3 elements that are in there actually trigger that we've never had before? And so we're seeing all kinds of things happen from the nervous system, brain, and the control of the mechanism, all the way down to the hormones, the pain firing mechanisms, inflammatory mechanisms, the energy production mechanisms. All those things start getting better because this one system turns all those on. So think about the domino effect. If you have, the first 10 dominoes that aren't even functioning, you never get to the rest of the domino chain, no matter how long it is. But if you get the beginning of that phase to work correctly and that communication process starts, that's what interesting. The other thing that intrigued me about this is not what we call an adaptogen, where we're taking one thing and trying to convert it into something else. This is not a stimulant where we're boosting something to try to make it happen. This is an activator, which means you turn on a signal and it goes down the pathway. And that's what I found that was really, really unique. And that's why we're going to see so many different variety of things that are happening. And yet it all comes back to putting one single element inside a drink and being able to drink that. So, Dr. Phil, anything you want to add to that?
Yeah, that's fantastic. Great explanation there, Dr. Ben. Thinking about the fat and the different types of fat that we have in our body. A lot of times people think fat gets a bad rap, but but we do have good fat, and that's what you're talking about. The cellular fat, the phospholipids that are around our cells and protect our cells, extremely important. That for us to have good, healthy fats and the amounts of those types of fat that actually are beneficial and help protect us. But I think about the visceral fat, and the visceral fat is what the fat that I was talking about that builds up around those organs, and like the liver, and causes the fatty liver disease. And it's that fat is harmful. That fat is more dangerous. So we don't want accumulation of that fat. And I will say, the people that I work with that have fatty liver disease, they're not skinny. They have a great deal of fat. They have an over accumulation of fat, and that's one of the problems. And that's one of the obesity issue that we're dealing with in the world today, especially in the United States, is a major contributor to a variety of different health disease disorders and diseases that people struggle with every day. And reducing that fat, especially the harmful visceral fat, which one of the things too, we talked about the anti-inflammatory effects. The hops extract itself has anti-inflammatory benefits, but also reducing that visceral fat reduces inflammation, because the visceral fat produces these inflammatory cytokines, which cause inflammation in whatever muscle, organ, gland that this visceral fat is building up in or attaching itself to. So I think that's important distinction there. You're making with the fat and the different types of fat that we have in our body.
Dr. Phil, let's add one more quick point to that. First of all, we know that 85% of what we need for life comes in through the mouth, down that digestive pathway, right? And so if we know that our basic building blocks are proteins and fatty acids, or what we'll call a protein fat block, here's what we find pretty interesting. When the body starts losing its ability to break down fatty acids, the next thing it starts doing is losing the ability to break down protein bonds. And then the next thing it has trouble breaking down are the mineral bonds or the mineral pieces that are in there. When we talk about food, we talk about 4 macronutrients: proteins, fats, minerals, and carbohydrates. So if you're having trouble breaking down the 3 main things that are necessary for sustaining life and repairing life, the only category left is sugars, whether there be simple or complex carbohydrates. And that's what we're seeing, that all of these issues begin building up over time. It's not a light switch happens overnight, but over time, we lose the ability to break these things down. And therefore, the accumulation of those things starts piling up. And that's why this extract turns on the ability to metabolize everything in the stomach. And now the body is going to see a lot more breakdown, a lot more building blocks, a lot more energy for repairability than is probably seen in decades.